Welcome to Calf Academy, your source for calf care education.
This session of the Calf Academy recordings will detail how to be most successful when walking a calf operation and evaluating the management on the operation. So the outline for the session, we'll talk through the purpose of the walkthrough, things to remember as you conduct the walkthrough, the actual processes that you'll go through, best practices, and then what are some risk factors that we can use to better assess what's happening on an operation. So let's talk about the purpose of the calf walkthrough. So why do we walk a calf operation? Until you get out in amongst the animals, it's hard to know to develop a good common knowledge of the base of the operation, of how it works, what is done on a day-to-day basis. By doing this, it really sends the message to the owner that you want to learn more about the operation, and by doing that, you're going to be creating a better relationship with that owner. And some of the things that you can bring to the owners of a calf enterprise is really uncover those factors that are holding the operation back from meeting their goals. Sometimes it can be that you're invited on the operation to help troubleshoot where there's a major problem or a crash going on. Bottom line is, when you take the effort to do a thorough walkthrough of a calf operation, you become a solution source for your customer. So some key things to remember, no matter what, you're a guest on the farm. So conduct yourself in a way that, you're visiting someone else's operation and you should conduct yourself accordingly. Keep in mind that the farm will automatically be looking for evidence that you're keeping biosecurity in mind. Are you cleaning up? Are you coming in with clean clothes and clean boots? Also remember that what you gather from the operation, that the information you have is confidential. If you take photographs, make sure you ask for permission. It always is a very interesting thing that you're there to look for things that are going wrong, for the things that are bottlenecks, for the things that are causing a crash. But you always need to find things that are being done well. That gives the farm the feeling that you're not just there to beat them over the head with the things that are wrong. Pick out and talk about the things that they're doing well. And finally, you really have to understand the goals of the farm. You have to listen to the owners, you have to listen to the workers, and you have to really, in fact, listen to the calves. What are the calves telling you about what's going on this farm? When a walkthrough is being conducted, it's probably a good idea to start from the beginning. Look at the dry cows. How are they housed? How are they fed? And then move to the maternity area. Where are the cows actually calved out? Where are the calves processed? What happens when the calves finally get their colostrum? Where does that happen? When does it happen? And then move on to the calf housing and the transport of how the calves get from the maternity to the spots where the calves are going to stay. Then you can get into milk mixing and feeding, really understand what's going on in those key areas. When you're evaluating the calf housing, always remember that you should go from the youngest animals to the oldest. And then finally, finish up. What do the calves look like after they're weaned? What are the procedures and processes of getting them weaned? And then how are they managed after weaning? So let's start with the dry cows. Are the dry cows clean? Are the pre-fresh cows moved to an area at least 2 to 3 weeks before they calve? Is the area pathogen free or as pathogen free as possible? Are the pens that the cattle are in, are they easy to manage, the cows and the calves? Because it can be a stressful time, so everything has to be well organized. So really understand then, when the calf is born, what are the procedures that occur to make sure that the calf is processed properly? And finally, are there any records being kept? If they're sick in the first 3 to 4 days, what are some things that may have happened around that maternity time that would cause that? So the calving area is very important. It should be clean. Out in the pasture and clean grass is one thing, but more often you're going to be looking in individual stalls or sometimes even in a large bedded pack where calves are going to be born. Are the areas clean enough? Are they well lit so you can observe things at night? Is there really a good way for the workers to be able to supervise the calving process without interfering unnecessarily? So the facilities must be clean. They need to be sheltered from bad weather. It's always good to have running water available to help keep things clean. And is there a very nice place to store equipment and supplies? So in the calving area, again, look for a well-bedded area with clean bedding, preferably a long-stem straw. A lot easier for animals to stay clean in that kind of an area. Is there a place that the cow can be restrained in the event that assistance is needed at the time of calving? Someplace that a cow could be moved and restrained by oftentimes a single person that's working with that animal. The restraint should be set up so the cow is able to safely lay down and potentially get up if you need to, and plenty of room behind for farm workers to be able to work behind the cow. So after being born, the next very most important item is colostrum. Get yourself in a position where you can evaluate if the equipment to capture or milk the colostrum, if that equipment is clean, is easily available. Can the cow be quickly milked out shortly after calving? And then, is there protocols in place to sample periodically to know that the colostrum is clean before it goes to the calf? Are there records available that you could look at that? So if colostrum is collected and stored, is the refrigerator actually working? We should have a refrigerator that has a temperature of less than 40 degrees Fahrenheit or 4.5 degrees centigrade. And finally, is there any type of quality testing being done on the colostrum? A very common instrument to be able to do that is use of a Brix refractometer. Has it been zeroed recently? Check the cleanliness of the equipment and the reliability of the Brix instrument as well. So if colostrum is not fed immediately, and if it's stored and frozen, there again it gets back to the freezer. Does the freezer freeze the colostrum quickly enough? Is the colostrum frozen in small enough containers that it freezes quickly? When the frozen colostrum is thawed, is it thawed in water that is less than 140 degrees? So we know that we're protecting the antibody proteins from damage. On the other hand, if it thaws too slowly, we have the potential for bacteria growth. So it should be thawed as quickly as possible without damage to the antibody proteins. On the farm, there should be enough bottles or tube feeders to feed colostrum to each calf during the day. That way you know that there's enough clean equipment around in the event that there's several calves born almost at once. Always have plenty of feeders and bottles and nipples to make sure that you're prepared for those calves that are born in groups and you don't have to worry about sharing equipment between calves. Oftentimes, a colostrum replacer can be useful. Just make sure that the colostrum replacer is one that will have an effectiveness to achieve passive transfer. And that typically means having at least 150 grams of globulin protein within the colostrum replacer. So when we're looking at calf housing and transport, the key piece that we need to understand is where is the calf actually receiving colostrum, and then where is the calf going to live for the next 2 months? And then, very importantly, how is the calf going to get to the long-term housing? So understanding that piece of it, is there a wheelbarrow that's used? Does it go in the back of a trailer? Is there a pickup that hauls the newborn calves over to their long-term housing, whether it's a hutch or a crate or whatever it might be? Really understand what that methodology of transport is. And finally, whether it's clean, because the newborn calf, at that point, it could be nosing around all kinds of things. We really want that piece of equipment to be clean. We want everything about what the calf has experienced so far to be clean. And that doesn't stop at the milk mixing and feeding types of equipment. We need to be clean, whether it's the bottles, nipples, buckets, the mixers, all the different things that are going to touch the milk we have to be thinking about. So cleanliness of the milk mixing system, and do we have any records that are kept to document who is doing what and is it being done properly? Is there a risk anywhere along the line of pathogens being passed on to the calf or from calf to calf through the equipment? So we need the equipment clean, stored properly, and it has to be convenient. If things are convenient, easy to do, they're more likely to get done. So this would be a really good time to ask to see what the whole process and procedures are involved. What chemicals are being used to clean, what types of brushes are being used, all of those sorts of things. Ideally, you could time your farm visit to occur at feeding and then be able to observe the cleanup after feeding. So determine what kind of feed they're feeding. Is it milk, or is it going to be a milk replacer, or is it going to be a combination? What is being fed? How consistent is the feed that they're providing to the calf every day? And is the feed going to be the right amount to meet the expected growth rate goals for the herd? Determine what the solid levels are. That is just a matter of understanding the weight of the powder, the weight of the water, and being able to calculate solids. Calculating solids is something that the calf specialist should be very, very well informed about. Being able to watch the mixing and how well things are being done is very important. Whether it's milk replacer, this is a good time if they're evaluating whole milk with a Brix refractometer. Are they using it correctly? Is the Brix refractometer cleaned after every use? It should be, or else it may not measure as consistently as it should. Lastly, are there any records? Do the calf feeders write things down on what they're doing? For example, it'd be a good thing to capture the Brix refractometer reading that they find every day coming from the whole milk if that's being fed. You want to look for evidence that the calves are being fed the same thing every single feeding. Calves crave consistency. So let's talk a little bit more about maintaining cleanliness, or sometimes we'll refer to that as just sanitation. So we're looking at bottles, nipples, esophageal feeders, buckets, all these sorts of things that we got to make sure that they are clean, they stay clean, and they're presented to the calf every day so they maintain that level of sanitation. There are several different ways to be able to make that assessment that will be covered in a different module. But one thing that many people miss at this stage are the nipples functioning properly. If bottles are being used or the nipples get worn out, there has to be a protocol in place that the calf feeders know when to discard a worn out nipple. That's the case with milk, but it's also true with managing starter grain. That starter grain has to be in a clean bucket that stays clean and that it doesn't get contaminated with water or rain or even bird droppings. So let's look at some different ways that work well to clean and sanitize and dry, especially in this example, like nipples. Oftentimes people will have a washing machine in the area where the feed prep is put together for the calves, and there will be a washer and dryer there for cleaning the udder cloths. This might be a good place to be able to throw a bunch of nipples in the washing machine. Washing machines are typically use really hot water and good detergent. Try that out and be sure you have a method like the ATP swabs to be able to see if your cleaning procedures in the washing machine work. You really need to avoid soaking the nipples and bottles in a disinfectant solution. That is not a good way at all to be able to make sure that the nipples are clean and ready for the next feeding. So this slide is really talking about if something is convenient, it's readily accessible, that there's good protocols in place, the work is more likely to get done. And in this example, are there nice racks to store the bottles on? Do you have a good sink to work in to make sure things are easy to clean? Do you have all the cleaners and disinfectants readily available, easily identified, with instructions on how to use them? Those are all key points. Making things easy to do, because something that's easy to do is more likely to get done. This applies to buckets, not just bottles and nipples. Buckets need to be clean and then allowed to dry. Here's an example of stacking up buckets upside down so they've got plenty of air movement around the bucket. Notice the buckets on the bottom. It would be good to have those buckets up off the floor as well to make sure that they get dry underneath. And if there's any doubt, if it's high humidity or a lot of moisture around in the room, it doesn't hurt to take a towel and dry the buckets, because a dry bucket is not going to grow any appreciable levels of bacteria. And again, don't soak the buckets in water. That does not do a good job of keeping them clean, or getting them clean, or keeping them clean. This is another example of just some inexpensive types of things that you can do to be able to keep things dry in between use. Here's an example of some nipples that are stored on a rack. The picture on the right shows some nipples stored upside down inside their bottles. This is fine if the bottles are already dry and the nipples are already dry. In this example, if you didn't take the effort to dry the bottles or the nipples ahead of time, you're likely to get some contamination building up inside these bottles because there wouldn't be enough air movement around to keep things dry. Again, here are a couple of good examples of organization, allowing things to be put in a place that allows good drainage, good drying, a well-organized type of facility. Here's another example of an organized calf room. Several different types of brushes, everything hung up, everything seems to be in its place. Here are examples of making things easy. In a smaller operation, they have the bottles set up with little carriers so people don't have to struggle moving the bottles around. It makes it really easy to carry and place the bottles correctly in front of the calves. Larger operations can have a bottle cart, and the bottle cart can also have a water container on the back, similar to what's shown in the picture. One of the hallmarks of working with babies is always start with the younger animals first. The younger animal is going to be more vulnerable, more susceptible to disease situations that older calves have already worked through, and they're much healthier and better able to respond to different types of exposure to diseases. So always work with young calves to the older calves. One of the fundamental things we have about working with baby animals. So let's move into some management observations. How do we go about looking at bedding, heat supply, blankets, water? How are calves moving? Are they continuous flow, all in or all out? Looking at some isolation and backup facilities, and again, a little bit more on proper equipment. So we'll look at each one of these in more detail. So the whole calf housing area, wherever the calves are housed, is the area able to be cleaned? Just to ask yourself that, how easy would it be to clean the area for a new group of calves to come in? In the picture on the right, you can see that this looks like a concrete slab. It looks like the surface is well cleaned. It looks like the hutches are cleaned out very well. The new calves that are coming in have the best opportunity. Is there good bedding? Look for that. Or is there any indication that the calves that go into these hutches had some type of obstetrical issue or anything like that? Calves that had struggle being born are going to be higher risk calves. So look for ways that these calves can be identified. And then, as you go through the housing area, since you're going to go from younger to older, and the feeding should be from younger to older, you can follow the milk feeder, looking at each calf as you go. How aggressive is the calf? Do they come up to drink readily? Gives you a chance to look at body condition, what the bedding looks like, what the calf manure looks like. Look at the nose, mouth, and ears of each calf. Is the ears drooping? Are the eyes clear? Just looking to see how aggressive the calves are at feeding time. Do they seem hungry? That's just a good question to ask. So as you're doing your evaluation, look at things like the starter. Look at the water buckets. How clean are they? Does the water in starter look fresh? Is the quantity appropriate? For very young calves, we want to have starter in front of them, but we don't need a lot of starter. Just enough starter to get the calf interested in nibbling on it. Look for signs of diarrhea. Are the calves scouring? What age does it start? How long does it last? Get an idea on severity, and then again, look at records to see what calves have been treated, how often they've been treated, and if the treatment seems to be effective. Oftentimes, farms will mark calves in individual pens with certain codes. Sometimes they'll put different colored tape, or they'll use different colored clothespins to be able to mark. Ask questions about what each of the codings mean. Oftentimes a red piece of tape will mean the calf was treated for scours. That would be just one example, but get a good idea of what these codes mean. So as you're walking the calves, look for evidence that the calves are growing. When they get about 2 weeks old, they should be very aggressive. They should start to fill out. They should be developing into an aggressive, healthy calf at that age. As you're walking these calves, understand what the different transition is from one level of feeding to another. Oftentimes farmers will have a phase feeding where they're feeding different amounts at different ages. Know what those phases are and be able to observe the differences in the groups of calves. As we mentioned earlier, make sure you look at the starter feed volume, and is the starter fresh? The volume of feed in the starter bucket should be appropriate for the age of the calf. I really believe that calves, even at a day or two old, should have access to some level of starter. Get them used to nibbling at the starter. and making sure that they get a little bit of that early starter in their developing rumen will help accelerate the overall development. To get an idea of whether the consumption of starter is increasing steadily as they get older. And then finally, make an assessment of how much starter the calves are eating at weaning, what the procedure is for weaning, and really understand from the farm, how do they know that a calf is ready to be weaned? Oftentimes, the goal will have 3 or more pounds of feeding consistently every day. So just because a calf would eat 3 pounds one day and not the next, does not mean that calf is ready to wean. We need consistently 3 or more pounds, maybe even sometimes up to 5 pounds of starter to get that calf ready to go off from milk completely. So at the time of weaning, respiratory problems can be a significant problem because calves, when they transition off from whole milk or milk replacer onto dry feed, sometimes the rumen isn't ready to provide all the nutrients that the calf needs, and one of the things that suffers is the immune system. So go out and look at the weaned calves, the pre-wean and then the weaned calves to see how well they're doing. Look at the records to see if there are any treatments for respiratory disease. Look at their body condition. Once they move it into the weaning pens, they still maintain the level of condition that they had prior to being moved. This is a real important area for the farm because calves that can gain well up to weaning and then they lose all their gain after weaning, the farm doesn't gain very much by that happening. So just as a summary, the housing practices that are the gold standards is, eliminate nose-to-nose contact if at all possible, especially eliminate that contact with older animals. The bedding always needs to be clean, dry, and plentiful. Calves get chilled easily, so eliminate drafts. Allow the calf to get into an area where it isn't exposed to chilling drafts. However, the calves still need to have good ventilation, good clean air. So well ventilated and dry without a draft is the thing we have to be looking for. Then again, always manage calves from young to older. All in, all out housing in calves is as effective as it is in other species like pigs and that sort of thing. Really strive to make sure that young calves don't get placed into housing with older calves. Now with auto feeder types of group housing, that becomes much more challenging. But keep in mind that really we'd like to get as close to all in, all out as possible. So clean, dry, and comfortable without a draft. So that means we have to control moisture. And the way we can control moisture is to use ample amounts of bedding, making sure that even if there's drains underneath the bedding, gives a chance for the water and urine and liquids to be able to drain away. So this it's an attempt to show what adequate amounts of bedding in a draft-free environment would look like. Always work the calves from young to old. In an example of this calf barn, the calves enter on the right of this building and they exit on the left. So calves are always moving from right to left down the pens of this barn. There's a good cement pad in front to make sure that all the feed stays relatively clean. There's doors on the end to allow for scraping and easy removal of manure. And of course, the roof helps keep the rain out and helps keep the calves drier. So as we already talked about, when calves are moved to the weaned pens, it's a good idea to make sure they have access to the same starter feed. When they move to the weaned pen, you don't want to be changing the feed at the same time. So maintain that level of starter, in the weaned pen for at least a week or two. And if calves haven't been used to having any type of lockups or anything like that, you're going to have to give them a chance to get used to the lockups, or to be able to stick their head through a opening. That might be the case with some calves as well. And then finally, make sure when calves move to the wean pen that they know where the water is. Oftentimes, the pen can be big enough where calves have a hard time figuring out where water is. So make it easy for them. You can put a bucket of water or a barrel of clean water in the pen just when the first calves first enter to make sure that they get plenty of clean water to drink. When do we start feeding forage? If the calves were fed forage before they moved into the wean pen, which can be common because people hold their calves into the hutches or something like that for a longer period of time, what that does is it allows the calves' immature rumen the ability to start to digest forage. They have to have the right bacteria in the rumen to be able to do that. So if no forage was offered to the calves when they were on milk or before they were moved into the weaning pen, wait at least a couple weeks to be able to offer forage to them then, because you want them to go into the wean pen eating plenty of starter feed before you put them on the forage, and allow plenty of time for the calves' rumen to become used to having that forage in their rumen and be able to digest it. As these calves get into the wean pen, just make sure that they're, again, clean, dry, and comfortable. They have plenty of space to lie down. They have good ventilation, and that these calves aren't overcrowded in these wean pens. So when there's a problem on a farm, there are certain steps to go through in the investigation that can help. One of the things to think about, though, is how organized you are in going through the investigation. Clearly identifying what the problem is. That's a big part of early steps in the investigation. Really understanding from the owners and the workers of what they're experiencing, being able to look at the records to be able to confirm what they think the issue is. Oftentimes, the problem is one of how many calves are sick or morbidity, or how many calves died, or that's called mortality. When is there too much morbidity or mortality? Morbidity, when more than 25% of the calves that are still on milk are treated for one thing or another, that's a problem. If more than 5% of the animals die, that's also a problem. And oftentimes farms will want some kind of investigation done even before it gets to that level. So it really helps to get real numbers. The farm may have an idea that things are going wrong, but it is a good practice to be able to document the treatment records and the losses, because you want to be able to make sure that any intervention that you recommend, there's a way to be able to track and whether it's working or not. And from this data, you can try and better establish what's the at-risk group. Is there a time frame that's worse than others, or a season that's worse than others when evaluating these sorts of investigation steps? So we're going to identify the problem. What are we looking for? Oftentimes we need to start with the records to really be able to understand what's going on the farm. So an example record system is here where we have the animal identification, the age, fecal consistency. In this example, it's showing some lab tests that were done. It looks like we had in this example one calf that had evidence of coronavirus, and some calves have an evidence for crypto. So here's an example of record analysis to try and identify the problem. So once we identify the problem, what are the sources of infection? Where is the disease coming from? If it scours, is it coming from the environment where feces is getting in the mouth of the animal somehow? Is it coming out of secretions from some other calf in the pen? Is it coming out of a aerosol in the air? An example would be coronavirus. Can be very, very common to find on all kinds of surfaces within the calf facility. Likewise with respiratory, is it spread by coughing and aerosol types of things, nose-to-nose contact, other animals, shared resources? For example, do calves coming in from a neighbor's calf truck, or their waters or feed that's contaminated from one calf to the next? Keep all those things in mind, trying to identify where's the source of the problem. So a real example in really young calves, particularly ones that are just been born and they're sick at 3 to 5 days, we often go back and think about, did that calf have a manure meal early in its life? So that could happen in the calving pen. It can happen when the calf is up and nuzzling around, trying to find the udder and teat of the cow. It may lick or suck on the leg of the cow that would have manure on it. Sometimes the udder hasn't been cleaned properly, and when the colostrum is collected from the cow, we can get manure actually in the colostrum. Another very common place is where the calves are kept right after being born. Sometimes there's heat lamps in this facility, and if one calf comes in contaminated, it can contaminate the entire area, and especially with warming lights, it can really create for a buildup of the pathogen within that little facility. And finally, as we've already talked about, the calf transport vehicle. How clean is it? And how often is it cleaned? Because manure in this area, as the calf is struggling to stand, move around, it'd be real easy for a calf to get manure in its mouth. Look at the calf bedding. The calf bedding is really important. When the newborn calf comes in, it should have completely new bedding, completely clean. We got to make sure that calves aren't placed in the hutches or in the pens that have manure from older calves. The level of bedding has to be thick. If it's less than 3 inches, it's a problem. Even in cold weather, it should be at least 6 to 12 inches of bedding between the calf and the ground. Certainly in cold weather, that's true. 3 inches seems to be enough to keep it between the calf and the manure that might be built up there as the calf grows. Look at, again, if there's calf-to-calf contact, see if these calves have a continuing bedding base from other calves. That's always a bad thing. So really ask those kind of questions and observe what you want to know about, the bedding base for these animals. Another one that is oftentimes ignored by farms is that water or feed refusals, like water buckets, for example, will be dumped out right in front of the calf pen. Encourage farms or feeders to have a barrel that they could dump that water in. It'll keep it a lot drier in front of the calves and less likely to build up high levels of pathogens, especially if there's milk that's spilled around the area, and certainly a lot of excess flies in the summertime. So another area of contamination we have to look at is, what are the calves being fed? Either the milk or milk replacer or the dry feed. Are any of those being contaminated somewhere along the line? For example, milk replacer. Oftentimes people will have a 30-gallon garbage can that they dump bags of milk replacer in, so it's a place to store. But oftentimes those types of containers don't get cleaned very often. So keep your eyes out for things where the feed itself can become contaminated. Those areas where the feed's prepared and where the feed is stored. When we look at calves that may have respiratory problems, look where the source may come from pathogens moving through the air. We call that aerosolized pathogens. So that's very common when they're housed close to adults or weaned heifers. It's more common when there's poor ventilation, high humidity, changes in temperature, things are wet and damp, or we've just got a lot of calves in one area where air quality can just be an issue. It always is a good idea when there's a sick animal within a group of calves to move that sick animal somewhere else, somewhere into what could be called a calf hospital, for example. So it's inevitable that some calves will get sick. There's just no getting about it. The things to look for are, what are the treatments? What are the protocols? What types of medications are being used? Are they being used at the correct dose, the correct route, the right frequency? And are these medications being stored properly? So even in the best of farms, there can be a low level of morbidity or mortality, but if the treatments are not going to be effective, that can help make the problem worse on these types of farms that are ordinarily well managed. So let's move on and look at what are some of the risk factors that exist on these calf enterprises. So looking at those sort of things that we know just from our experience in history, that calves that have this type of risk factor are more likely to have challenges and less likely to meet the goals of the farm. So there are many different types of risk factors that could play a significant role in whatever the disease problem is on a particular calf operation. So anytime you're doing a type of investigation, keep an eye out for those type of factors, that could contribute to chronic diarrhea or pneumonia problems, and try and do those sorts of things that you could help the farm prevent an outbreak of scours or respiratory disease or other diseases if you can identify these high risk factors that may exist on a farm. So the number one risk factor by far is the ability to provide adequate colostrum to the calf within a very short period of time. When you have a group of calves that have a failure of passive transfer and more of them become exposed, more of them get sick, the level of pathogens in the environment are going to increase. The goal of any farm should have all of their calves to have adequate absorption of colostrum. Another key risk factor is bedding management. Are these calves clean? Are they dry? Do they have the ability in cold weather to be able to burrow down in the straw and stay warm without coming in contact with wet manure? By doing this, you avoid the increase in humidity that will often lead to higher levels of respiratory pathogens and ammonia levels that can then lead to things like respiratory disease or even higher levels of diarrhea. So at all times, calves need at least 3 inches of clean, dry bedding between them and the stall base or pack. And it is also helpful to have some type of drainage under the pack to allow the manure liquids to be able to leave the pack area and help maintain the level of fluffiness of the bedding. So another significant risk factor is how much exposure does each calf have to other calves? So the amount of crowding that can occur. So that leads to the higher level of calf-to-calf contact, the higher level of moisture, the higher level of manure, urine, and all of the other things that go with the crowded conditions. Especially when one animal gets sick, there's more likely to get other animals sick. So making sure that there's the right concentration of calves, especially in group settings. Calves that are housed in individual hutches certainly are not going to have the calf-to-calf contact that you would have in settings. So really do a good assessment of how much space is available, how many square feet per calf is available, and decide if that's adequate or if the farm would be better to decrease the total density within the calf pen. The whole concept of all in, all out timing is well established as an important type of factor when it comes to exposure of newborns to older calves. And again, sometimes in group pens, it's hard to be able to do that, especially with the new automatic feeders. In individual hutches or individual crates, oftentimes it's very easy to be able to maintain that all in, all out timing. In reality, what happens is farms get flushes of calves that are born, large numbers that are born that overwhelm their ability to maintain a good separation between calves, and oftentimes they need to double up hutches or that sort of thing. So really encourage farms to have a higher capacity than what they need on average. So once again, these commingled age groups, that is a significant concern when we've got young calves with older animals, whether they're weaned heifers or even with the mother cow at birth. That cow at calving is going to be stressed, and it may make her be able to have some pathogens released that normally wouldn't occur in anybody that's not stressed. But calving can be a stressful time for a cow, and she may pass some pathogens that she normally wouldn't have. So that just puts the risk on that newborn. So whether it's the newborn to the mother, the newborn to older calves, or newborn exposure to the weaned calf. So it's always a good idea to think about moving calves to an individual pen before they stand, so within 30 minutes, and before they are eager to start nursing, so within 90 minutes as an example. Adequate ventilation. So air hygiene is a risk factor. Calves that are raised in wet, humid areas are going to have a real high level of bacteria that's going to be in the air. So keeping the ventilation adequate, controlling humidity and dampness, decrease the animal density, can all be things that you can do to decrease the amount or number of aerosolized organisms or ammonia, other types of gases or contaminants. So always evaluate the ventilation in a calf barn, especially in those calf barns that are older, that may not have good drainage, those barns that have got many different ages of calves in them, or those barns that don't have any type of ventilation at all. So additional risk factors to think about is feeding variation. As we mentioned before, calves crave consistency. And anytime a calf is not going to get their feed when they expect it, it can create some anxiety in the calf of wondering when it's going to get its next meal. So be very consistent in the amount delivered, in the time that it's delivered, and how well the feed is mixed. Calves will also learn to drink water, so feeding water immediately after feeding can be a learned behavior for calves. And by being able to have a good protocol and good timing of water delivery can really help calves stay adequately hydrated, and this will also increase their starter intake. Anytime a calf is handled for one reason or another, whether it's to give vaccinations or dehorning or provide some other medications, all of these can be stressful things for the calf. So anytime you stick a needle in a calf, that could be a high level of stress. So minimize all of those types of activities with calves. And for example, like with dehorning, doing that at a very early age is much better than at a later age. So all of these sorts of things are very hard to remember everything. So it works really well to have some type of a chart that you can use to take notes on that goes through every single step of the calf walkthrough that you want to be able to conduct. And, have this checklist available and be able to use it to take brief notes. So you can look at the maternity area, colostrum area, milk mixing area, housing, feeding program, general thoughts about herd health and biosecurity. And don't forget about, the employees. Do they have the adequate type of training that they need? Especially early on in your ability to conduct a thorough calf walkthrough, using a checklist is a good thing to be able to help develop your skills and your value to the farms that you're working with. Thanks for paying attention through this module on doing a calf walkthrough.
Thank you for completing this Calf Academy course. If you have follow-up questions, please contact your Milk Products National Account Manager